Hi, everyone. I am doing a recorded presentation for today. And so go to both sections because they're both at the same place, which is chemical methods of control. Hopefully, I can do this in one sitting. We'll see. And it's all about whether the dog is going to permit me to do this without, he seems somewhat quiet at this point in time. So, without further ado, let us begin. And so this is, and again, this is the Cowan PowerPoint, or it's the textbook PowerPoint to start with, and I'll flip over the other side either today or and obviously the next time we'll be looking at this stuff will be Wednesday when we return because Monday's the exam day. A quick word for both classes on Monday. It's a little easier for the morning people, and I'll send you an email about this too. As usual, I generally will walk in there about 20 to 9. You can get started. And I know we have someone comes in after us, but that should be allowed for plenty of time. I don't want you to feel a time constraint necessarily. And Mondays are a good day because of this. And for the second group, time is an issue because I mean we can start as soon as that room clears. I even start because I don't have to get up and start with the computer. So as soon as you get there, it's afterwards. So the hour I think will be enough for this particular exam. But if it is not, and for some reason you need extra time, we will run up to the lab, which on Mondays will be open, over to the A&P lab, and we'll just do it there, not the micro lab, the A&P lab because it's so convenient. So if you need some extra time, don't stress. We'll figure this one out. So without further ado, methods of chemical control. So you can see where we are here. And you're going to see we can use solids, liquids, or gases, most commonly liquids because they're most convenient. I mean, you will see probably the one that's used the most is gases, just from a standpoint of if you look volume of material. That's part of my voice this morning. It's early. Better yet. So again, and I'll try to characterize them each as my feelings and what really they are, disinfectants and antiseptics. I have a ton of experience with this. You might remember me saying, and I don't know if I said it to both class, when we talk about things that are aqueous, they're dissolved in water. It doesn't. They say pure water, you're not adding anything to the water, but inherently the chemicals can have other things in them. Okay, the water just becomes a solvent, and if they're and a tincture by definition, pardon me, is more than 50% alcohol. It's not a question I'm going to ask you about this per se. I mean, maybe generically, I mean, true or false tinctures are more than 50% alcohol. Fine, that kind of a question. But you're going to run into the term tinctures. We see that more historically. And I'll get to that when we start talking about the implications of all of this. So, what do you want? You want something that works without having to use a lot of it. Bleach is really good with that, for instance. Okay. It's nice that you can have something that's shelf stable for long periods of time. Not always the case, let's say, with bleach. You want it to be broad. I mean, this is a panacea. We just don't have that. Something without being toxic to human animal tissues and a broad spectrum. To me, that would be the optimal. I don't know if we have anything that really fits the bill per se. Something that penetrates surfaces. Okay, penetration of an inanimate surface to sustain a cumulative or persistent action. It's more about leaving a residue. And generally, we have things that leave residues, but if anything, there are some of the residues that work better, as you will see, are more able to be utilized with skin. I'm just talking generically. Not a whole lot of things work well with organic material. Big problems with corrosion. Big problems with staining. Uh, It'd be nice. The odors sometimes are problematic. I don't really worry about sanitizing and deodorizing as much, depending on the task I'm trying to accomplish. It is a little bit more significant deodorizing, I would think, in respiratory patients. And again, cost is not something people think of when they're employed by a big hospital corporation. Depends on what you're doing in life. So this is the way yeah, and this is fine. I mean, to me, again, there's so much terminology. To me, a sporicide is the highest level. That's something that can kill endospores and can sterilize. Everything else is below it. I mean, these low level agents are, again, that's probably more that alcohol wipe. Doesn't mean it's a bad thing, but not a whole lot to say about it. So we have to look at, we have to have some knowledge at times. If we don't, that's different. But if we have some knowledge of what we're trying to treat it, okay, if we're trying to get rid of in that particular environment, the material is very important because when you're losing chemicals, will the chemicals destroy it? Are they amenable to that particular chemical treatment exactly? You know, do we have to heat things up at the same time? How contaminated they are, and that's another role that usually implies time and certain materials or pre-cleaning, how long you have to use it for, and really all the parameters that are involved. But I think this is fairly obvious. This probably is a good idea. When you begin to see tuberculosis, a big problem. Okay, 50 seconds with a and that's not a particularly relatively large things like that. It's really not. Okay, hepatitis A virus, as you'll come to learn, is called a naked virus. Okay, you don't need to have quite as many parts per million, but you need a lot more time. I mean, these are the kinds of things you look at. Alcohol, which we use commonly, good old 70% alcohol solutions. As you can see, we're not more time, it evaporates too quickly. It's almost like letting it soak in the alcohol. You don't see that. And some agents work more rapidly. And I mean, the times are interesting. And you don't have to know any of these times. Like these guys. When we talk about, I want you to frame it this way. It's better if you look at the charts after and see just what we use these things for. But when things only take seconds, they have a greater degree of use than things that take longer periods of time. As you can see, alcohol, too much time to accomplish its task. It evaporates unless you want to soak it, and we just generally don't do that. Peroxide has, seconds is a good thing. Okay. That's why peroxide has a lot of usefulness and it's environmentally friendly, as you will see. Quats are something we use all the time, and they're things that are an antibacterial soap. Get an idea. That's why it's about the mechanical action, hand washing, and the assistance of those agents. Okay, this is the poison gas that we use, and it's there for a long. They have an optimal period of time. Those agents, and it's interesting with that whole influenza virus thing. The point is that those items are being they're in a place where they're being used in a place where they're not going to be contact with an influenza virus. It's a manufacturing plant in a closed environment, sealed specifically, and then treated. You know, I wouldn't worry the next time you take a sterile Q-tip out that, oh my God, there could be influenza virus if they only did it for 24 hours and 33 minutes. So let's look at the categories. I mean, there's when you have a slide like this, there's a lot of information, and that can get you. But what it tells you, chlorine, halogens are two major players: the disinfectant chlorine, the antiseptic iodine. I'm not buying unless it's pure iodine for a long period of time that it really is a satisfactory sterile. I don't buy it. To me, it's an antiseptic. That's the way we use it. It's too irritating to the skin. I'll get to that. This I can buy, okay, albeit slowly. There's a lot of different forms. We typically use the liquid form. We dissolve it in solution, and again, who cares what they denature and what bonds they do, etc., etc. I mean, there's a lot of, and as you'll see, there's a lot of indications for all of those things. There's so much stuff that you can see here. It's there, and to me, it's overkill when they put all the stuff in a particular category. So here, these are where I would look at them. Less effective exposed to light. That's why the containers that you and I buy for bleach, if we're going to use it for laundry bleach or for bleach for any purposes, it's in an opaque container. Okay? Because light damages it. It doesn't work well at an alkaline pH. Okay. And organic matter is an issue. So you got to pre-clean things off of it. Oops, went too fast, too quickly there. This is the big problem. Why it is not. Why we had to change the formula of iodine, because it's skin. There's toxicities. Okay, and so the way that they use these things, and particularly these consumer products, you have to be careful with it, with the iodine. I mean, and those are legal or governing bodies that have those things. We use it extensively in healthcare, and you can use it at home. Using that in consumer products, I'm not totally unfamiliar with. You're going to see hydrogen peroxide, high concentrations. We'll talk about that. So to me, this is sort of the overlap guide. Pardon me. This is the agent that works very effectively in the proper way and in a proper environment to deal with both antiseptic and disinfectant purposes. I mean, we can sterilize with it, but most frequently we're using that. You might recall me talking about those like suitcase systems that they use for endoscopes. I mean, and we call that vapor phase. You might recall me talking about just just the other day, talking about what they call ultra pasteurization. Those containers have hot vapor phase peroxide used on them. Okay, because it evaporates so quickly. It is sporicidal in that, and it's a remarkable system that allows us to have things like juice boxes, for instance. My voice is awful this morning. Yeah, we can use it. Okay, typically we buy it at 3%. We cleanse it. We use all of these different products, and it evaporates so quickly. That's why it's environmentally friendly. Problem is, as I'll review this, I'm trying to go through this chart and go back to another chart on the other PowerPoint because I think it's a little less wordy. But you're going to see both betadine that we just did, or the iodines rather that we just did, and you can see the toxicities that are there. And peroxide are not good choices full strength, particularly for wound care. We'll discuss wound care down the road, but a lot of people make a mistake of using initially full strength peroxide and full strength iodine, fine. Long term, with a slowly healing wound, is bad. I have, again, a bit of part of a quarter century of experience treating diabetic ulcerations. They are extraordinarily difficult to treat in long term care. They are like decubitus, bed sores, that many of you will encounter, which I again have a lot of experience treating, having done nursing home patients for many, many years. Understand that is an error. I'll talk about that more when we get to the specifics, but you typically need to dilute them by about 1 to 10, and they are just as effective for long term care for wounds. More on that down the road. Aldehydes, I mentioned that in passing. It is a very, very useful agent. The big problem with this, and it's sporicidal, okay, the way that it works, okay, this ortho or orthopaldehyde, I don't know how to play it, how to pronounce it properly, is probably not as strong, but a little more user friendly these days. All of these things, look what they use it for, and this is what we use it for. Okay, it's just as effective. This is a new agent that came out. Glutaraldehyde is what I used in my office, and these are the ones we had to change out every night. It's concentrated. It came in a little container, plastic, again, like maybe a 2 to 4 ounce little plastic container that was opaque because sunlight could affect it. We made a new batch up with distilled water every day. Okay. And we changed out all of the things and had the instruments soaking in there overnight and in between patients. In between patients was a disinfectant. Okay. The problem was it has a residue when it gets on the skin. So you have to almost take them out carefully with an instrument and then cleanse it, wipe them off with alcohol or water or at least remove as much of the residue as possible because it would irritate the skin. So it's not something you can use on skin nicely, but it's effective, particularly for instruments that will dull over time. Yeah, they're not moisture sensitive, but heat sensitive. And you have to see it in action. What it is, and I'll talk about that a little bit more, just over time. And happy to answer questions. And you can see dental instruments would file into this. I mean, this is somebody who using continuously going room to room and using instruments needs something that works fairly efficiently, and particularly when you're not using it, they don't by definition have to be sterile. They start sterile, but you need a lot of instruments to do procedures that are there. Best way to explain it, I think. So there's some instability issues, and the orthaldehyde has become a little bit used more frequently, is my understanding. That came after I had gotten out of practice. Number one agent, when you talk about gaseous agents, they have a category of all their own. They sterilize, and this is the bad boy that does. It's called ethylene oxide, poison gas. Gas at room temperature, destructive, plastics, delicate instruments, syringes, supplies, medical devices. All of them are done with poison gas. When you open up a sterile packet of gauze pads that you buy at the drugstore, for gauze pads from Johnson and Johnson, Band-Aids, Q-tips, needles, syringes. They have all basically in a room the size of our classroom. They have all been pre-packed because the gas will penetrate the packaging. They have been placed in a sealed room, a gas chamber, for lack of a better way to express it. And they fill that room with poison gas. And the poison gas is there for X amount of time, X number of hours, and then has to be effectively, because of safety for the people who are working there and doing all the work and doing all the processing, have to be sucked out of the room, contained, filtered, however they neutralize it or contain it to destroy it. Okay. It's explosive, and this is why we do it. It's carcinogenic. It's damaging to the environment. These are with a high percentage of carbon dioxide or fluorocarbons. It can damage lungs, eyes, mucous membranes, rated as a carcinogen by the government. Interestingly enough, sidebar, when I started in practice, 1979, we had the choice of getting what's called a gas clave or the autoclave that I talked about before. I got the autoclave because it was less expensive and you didn't have to buy these gas cartridges to do sterilization. The gas cartridges were nitric oxide. It was not restricted less than 50 years ago. Okay, it became restricted. I'm not sure when it changed, but you had to get rid of them and change your whole sterilization. I mean, I just thought it was an easier system to use because we were familiar with it. Okay, when I started getting into practice, my first wife said, "Hey, you gotta get one of those. I can handle it," and we did. An agent I'll spend a little time on is called phenol or carbolic acid. This is an antiseptic, but it can also, it could be a disinfectant. It's both. It's all about the concentration. It's been around forever. Okay, carbolic acid. You can see it's derived from the distillation of coal tar. And coal has been mined for a very long time, obviously, as an energy source and a heat source, etc., etc. In chemistry, it's called an aromatic. It has to do with organic chemistry, and it's used all the time. Phenol, carbolic acid, and phenol acid, it's very nasty if it's concentrated and it gets on your skin. I used it to cauterize warts. I used it to cauterize nails that I had removed, nail beds, so the nail wouldn't grow back at full strength. They're poisons, disruptive, etc., etc. In lower, they inactivate certain critical enzyme systems. Okay. They have a thing called a phenol coefficient we don't have to get into. Phenol is now only used in certain limited cases. drains, cesspools, animal quarters. They're very toxic. Many phenols were banned, and this is significant. One called triclosan back in 2017. If you go into somebody's house in the cupboard where they had a bunch of soap, and maybe for some reason there's one in the back, it might say it contains triclosan. This was the soap that was the antibacterial soap in all antibacterial soaps. And because of the toxicities over time, then they began to do studies and they saw accumulation just from using it on your skin. It was absorbed. And we're seeing higher concentration of things like people's livers when they were doing biopsies. Okay. It's been a very interesting product. This was the agent that Lister used. He diluted it enough. And as he began to dilute, it had different properties. If you dilute it, as you begin to dilute, you get to a certain level, you could actually use it as a local anesthetic. As you diluted it farther, he was extraordinarily effective, and it's great against organic agents. And that's what basically that was the agent, diluted phenol that he used, and the name Listerine originally that was a phenolic compound. So you don't see them today. They made one called hexachlorophene. Hexachlorophene was a topical antibacterial agent that was used mostly in the 60s, and it actually worked on Staphylococcus topically very, very effectively. Okay? Trouble was it absorbed, and people just discovered it had a certain degree of neurotoxicity, and they kept altering it until finally we get to triclosan. And that's the problem, is trying to deal with the toxicities. It's very effective. As you lower the concentration, it became a very effective antiseptic. If you raise the concentration, it's very destructive. And I don't even think you'd consider it a disinfectant. And in between, you actually use a local anesthetic. It's very interesting. Chlorhexidine. It's an organic compound. It kind of looks a little like you had a couple of phenols get together. There's these two phenolic rings. It's really a good way to express it. It is the standard of care. It's the standard of the art, I think, and most people agree with me, for antiseptics. It is not a sterilant. There are two agents that you use when you scrub your hands. We'll go back and look at iodine again. I just wanted to do this synopsis style here. We'll go back and look at iodine again. But there are two. One is chlorhexidine, Hibiclens, Hexaclens. It's in a category you'll see when I go over to the next PowerPoint, and I probably won't get to that today, called biguanides. And biguanides are really, to me, the state of the art. They have for indwelling catheters. They are useful for surgical scrubbing of hands. They are useful because not only are they effective, they leave a residue. And it's not a residue that's corrosive. It's a residue that's very, very desirable. You'll also see that people still use a lot of betadine soap. Betadine soap is designed to go with the skin, both betadine and chlorhexidine. And again, the category you'll learn this about are called biguanides, are better when we mix them with soap. They're more effective as an antiseptic, much more effective. That's the beauty of them that are there. And it's mild, very low toxicity, very quick. Hand scrubs, prepping the skin for surgery, obstetrics. Okay. And you're going to hear a lot about catheters, particularly if you're in nursing. I mean, indwelling catheters like Foley catheters that for people who have urinary tract problems, and you have to put a catheter in to make sure that they can void. It's so hard to deal with. I mean, this is by no means a sterilant and by no means a disinfectant, but it's a great item. Anecdote. I'm one of those curious people. Even as I no longer was in practice, I was always curious because it was like one of my pet things. We always used betadine in the office because the chlorhexidine wasn't around. I started to teach about it. I said, gee, I wonder what they're using this stuff. Until occasionally, every time I was in the hospital for any reason, Like, I had an occasion where one of my family members was, had an emergency room on hand in there, nothing major in this particular instance. And what happened is I looked between the scrub sink between over the UPMC facility. I looked at the scrub sink between the rooms in the ER, and what do I find? Chlorhexidine. the, the key is, and early on, now it's very relatively affordable. Early on, all the hospitals didn't switch because betadine had been around for a long time and it was very cost effective. Chlorhexidine was expensive. I mean, a little bottle used to cost about $8 to $10. Now it's much less expensive, and the hospital switched because it's a better product. If a big hospital, this was UPMC, switches to it, everybody switches to it. It's like it's follow the leader a lot, like it is in a lot of things that are there. And when a leader in the healthcare industry says we are changing over to X, everybody else goes, okay. Because you never want to ask the question, well, if UPMC does it, why didn't you do it? You know, that kind of thing from a medical legal perspective. More about that. I'm going to review all of these. I'm trying to give you the background. I presented in the morning class, at the 9 o'clock class. I didn't get to it at the 11 o'clock class. Alcohol. Alcohol has activity. It's. I'm trying to think of the best way. The two best things about it are its rate of evaporation. In about 15 seconds, it's gone. The best thing about it, which makes it useful, because it's not particularly effective. It takes care of enveloped viruses. It takes care of most vegetative bacteria. That's about it. But it dries rapidly, and that's a big advantage in the old days when we were constantly washing your hands. If you go to a patient that does not have for instance, in C. diff, you can't use any of those alcohol-based systems. You can't use the hand sanitizer system. You can use them after, but you got to wash your hands first because it doesn't work at all against endospores. So that's a no-no. So there's a lot of these things where you see a significant degree of contamination, depending on what you know about the patient. Wash your hands, and then afterwards you can dry them there, and then go grab the hand sanitizer afterwards if you feel your hands are damp. That's fine. But it's not the easy thing where you can go from place to place with just hand sanitizer alone. There are limitations. But around here for us, it's very convenient. Mhm. So a lot of times that's where it is. So that's its best advantage is it evaporates quickly. Its biggest disadvantage is it evaporates quickly. Again, that wiping down that skin with alcohol, if you don't give the shot in about 15 seconds, there's more stuff coming down on the lining on it. That's why I don't think it's a big deal. You could just as far ahead with soap or water. The hand sanitizer systems, just the same way with most soap systems or plain water systems, mechanical action. I mean, you can look at those studies. Is there an advantage to using certain soaps? Yeah. The chlorhexidine-based soaps, which are biguanides, better. Okay, statistically better. And then as we look more about these things, they continue to be kind of interesting, at least I think. I mean, I know it's a long-winded presentation, just going over a chart and me reading to it, but that's what happens. They're polar. And so we call a surfactant basically means the negative or positively charged aspect of it will be soluble in water. The other portion of it, okay, the other side of it will be more compatible. So it's a polar or bipolar compound, meaning that one side will be the charged side will work very, very effectively against it, rather dissolving water, and the other side kind of it incorporates itself into the less water soluble material, dirt, grime, yuck, like this. So anionic, negative charge, limited, cationic, much more effective. And so this is basically the area. The name that you are going to know them for, we call them quats, quaternary ammonium salts. That's what I'm going to go back and use the other chart. They're, they don't have a ton of effect, but that's the agent that's used in antibacterial soap. Now, it is very friendly to the environment. It doesn't have an odor. It doesn't have a bad taste. Can you imagine washing your hands with traditional bar soap? Okay. And going out and drying them, and then and you're in the grocery store. Let's say and you wash them, you walked into the grocery store and you had some soap residue left on your hand, and you start picking up fruits and vegetables. Nothing worse than having a soapy taste on something that you pop right into your mouth. There's a reason I'm giving you that illustration. It's coming up. This is the agent that's used in antibacterial soaps. This is the agent that's used in restaurants. This is used all the time, as you will see. Okay. So, ineffective against all of those things. Activity is greatly reduced in organic matter. So, I mean, you're washing your hands, it helps a little bit. But again, the polarity of it helps to remove the organic matter. Maybe you should wash twice. Functions best in alkaline solutions, some clots. Again, limitations with some of the problems. The one you see mostly are in there are benzoylconium chloride is the one you're going to probably see. I'll have to go look at my antibacterial soap. It's been around for a long time. Originally, it was marketed as something called Zephyrin, Zephiran. And metals, I'll save for a little bit. Metal compounds have been used for a long time. Those are more the solids. Sometimes we dissolve them and they become tinctures. Uh, not effective against endospores, but used a lot. Allergic reactions are part of it. So there's inherently some limitations. But metals are something that are used commonly. And this is part of the discussion I'm going to have with you. Fairly effective antiseptics I'll buy. This is tincture of mercury. We'll talk about that. So it's mercury compounds designed. In the old days, we had tincture of iodine and tincture of mercury. Every household had them. Those were the antiseptics you put on the scrapes and cuts that we all got as little kids playing outside. And we'll talk more about this from food perspective. I'm going to stop it now. Let's see if I can get back and do some other portions of it. Thank you very much. I'm going to try to go back and use the other PowerPoint. Bye bye.